Anyone can hear me? Please send me thumbs up. Anyone can hear me? Please send me thumbs up. Okay. Hi everyone, I am Charmi Gala, head nutritionist and lifestyle expert with Team Luke. I also head the pregnancy vertical with Luke. And since we are celebrating breastfeeding week, which is from 1st of August to 8th of August, also today we have Bone and Joints Day, World Bone and Joint Day. So today I'm going to talk about dietary calcium is so important to take care of bone health during breastfeeding. So let's get started. So there are so many researches which comes and shows the result that mother do lose some bone mass while breastfeeding. So dietary calcium becomes really important, and breastfeeding is one of the miracle kind of a feeling where you can feed your baby with your own body. So with this, we also need to take care of the bone health, and there are researches which says that around 3 to 5% of bone loss is seen during the breastfeeding. So anyone can tell me what can be the dietary requirement for a breastfeeding mother in a day? Like how much calcium requirement is there in a day? Can anyone comment in the comment section or answer your in a comment section? Any idea how much calcium to be taken? So how much calcium is required in a day for a breastfeeding mother? Yeah, someone says between 1500 to 2000. Any other answer? So the requirement is around 1000 milligrams per day. Someone says it is 2000 to 2500. No, the daily requirement, dietary requirement is 1000 milligrams per day. So always mothers need to take between 1200 and 1300 of calcium, which really helps mothers to absorb the calcium really well. So how do we understand that the calcium absorption is very well? First important thing is make sure your gut health is good. When your gut health is good, that means you need to include pre and probiotics, which really help for the better metabolism of calcium, and calcium is absorbed very well. Yes, vitamin D3 is also important. So please check with your healthcare provider, get your levels of vitamin D3 check done, and also make sure that if any other supplements required for vitamin D3, please have it, because this is going to help for the better calcium absorption, or vitamin D3 is required for the calcium absorption. So apart from this, there are a lot of studies which says that there is a bone loss which occurs during breastfeeding, which I've already told. But have you ever thought why this bone loss occurs? What is the reason behind it? It's only because your if the dietary calcium is not enough and your baby is going to basically take the calcium from the mother's bone, so that the whatever the needs for growth and development of the baby is required, that can be fulfilled, or there is some other reason to it. Anyone knows any answer for this? Please put your answer in the comment section, and so that I can definitely address this too. No worries. I will tell. Basically, what happens during breastfeeding, the estrogen levels drop, and when this estrogen levels drop, which actually protects the bone mass, because of the low estrogen, we can see the bone loss if the dietary calcium is not enough. So hence not only the food source high in calcium is required in the meals, but apart from this, supplementation is also important. In fact, there are so many researches which say that mothers who are taking good amount of calcium in their meals during breastfeeding, they have seen the lower risk for the hip fracture as well as osteoporosis in the later stage, because they have replenished the calcium to make sure that their bone mass is really good. In fact, after your postpartum recovery, like when your doctor give you green signal, yes, you can resume your exercise. Please focus on your exercise, because good amount of exercise, weight training exercise, helps to build up the bone mass. So now let's understand what are the different dietary sources which really helps to for good uptake of the calcium. So first important dietary sources, amaranth. Now amaranth is also known as Rajgira. So mothers can include Rajgira ka laddu, Rajgira ka chikki, Rajgira ka roti. So that can be really helpful. Apart from this, another important source is ragi. Now ragi can be also known as nachni. So nachni porridge or ragi roti, ragi laddus, all this can be included in our meals, which basically are good source of calcium. Apart from this, milk. I know there are a lot of myths which says that if mother drinks milk, she can produce good amount of milk. It is nothing like that. During breastfeeding, we need to really make sure that mother is hydrated well. But yes, in case if she want to have milk, then go for A2 milk, which is which is basically known as ghee cow milk, and not pumped with a lot of hormones, and can be can take in the form of milk, curd, buttermilk. This can be really helpful for making sure that her calcium intake is also good during the breastfeeding period. Apart from this, including coconut, which is in the dry or the fresh coconut giri, which is the white portion of the coconut, in our meals also helps to take care of the calcium. And sesame seed. So sesame seed can be used or topped on the rotis, dal, vegetables, or sesame seed chikki can be made, or sesame seed can be used in a tiny chutney. That can be also helpful. And if this all food should be included in our meals, as well as green leafy vegetables. Apart from this, most important is vitamin D. So vitamin D3 supplementation is important, and after including all these calcium rich foods, I will just make sure that whoever mothers come to us, that please take your calcium supplements for first 6 months, because that is really important, replenish the bone mass. So even in fact you can look forward for Gond ka laddu. Now Gond is also known as edible gum, which really helps to give the strength to the bone. So definitely can look forward for that. Over and above prebiotic, probiotics, exercise, having good hydration, good quality sleep will enhance the better absorption of calcium in the meal. So always focus on 4 pillars: having good quality sleep, your emotional health is really good, you're expressing your emotions in a journal, which is really helpful to take care of your emotions, where you went out, let go. Then your meals is good, your sleep, exercise, water intake. So all these parameters are being taken care, which basically indirectly take care of the good gut health. And if the gut health is good, then the absorption and the metabolism of calcium is going to be good. Anyone have any questions related to dietary calcium intake for the breastfeeding? Please do share your questions over here. I will try to reply as much as I can. Any questions, do let me know. There is a question, if my milk secretion is less, what to do? So make sure that you latch your baby very frequently. Also, your meal should have good amount of galactogogues. Galactogogues really helps to enhance the milk secretions, so make sure that is there in your meals. So few example of galactogogues is garlic, having bajra, then having green leafy vegetable do help. I am 40, so shall I take the calcium supplement? Yes, you need to definitely take a calcium supplement, but take it under supervision. First, get your calcium levels checked done. See how your overall health is. Then speak to your healthcare provider and go ahead and take the calcium supplement. Will be breastfeeding and weight gain can be sorted through intake of food. So breastfeeding is actually essential, which helps to build the baby's immune system, right? So first 6 months is exclusively breastfeeding. Weight gain can be sorted only when your 4 pillars are well balanced, where your emotional health is very good, you are exercising, your portion control is there, your hydration level is there, your quality of sleep is good. So all these things really matter. So it depends how your surrounding is, and it can help you accordingly. Should we consume more amount of carbohydrates? It is always never said that it is more amount of carbohydrate. What you need to do is balance your carbohydrate, or have a complex carbohydrate meals which is really well balanced with good amount of fiber and dal. Thanks, Parmi. Any other questions, do let me know. So I think there are no more questions. So in case if there are any questions, you can definitely put it down. I will try to reply as soon as possible. Till then, take care. Bye bye.